Hello, my name is Jacqueline Larizza, and I am a pediatric resident at the Northern Ontario School of Medicine. The article I'm presenting today is titled Evaluating the Appropriateness of Inpatient MRI Orders at TBR-HSC, a Choosing Wisely initiative. I have no conflict of interest to disclose. This study was conducted to evaluate the appropriateness of inpatient MRI orders at Thunder Bay Regional Health Sciences Centre, as there was noted to be an increase in inpatient MRI requisitions. This study aims to determine if inappropriate MRIs are occurring and to determine potential strategies to address this for enhancement of patient care. We looked at inpatient MRI orders from the month of May 2017, which totaled 157 orders, including adult and pediatric patients at TBR-HSC. We assessed for appropriateness of inpatient MRI orders by using Choosing Wisely Canada and Canadian Association of Radiologists guidelines for medical imaging. Other outcomes assessed were indications for MRI orders, quantity of positive versus negative findings on MRI reports, as well as appropriateness of the assigned MRI order priority status. In this study, we found that 94% of inpatient MRI orders were appropriate according to guidelines. From the total MRI orders completed, about 50% resulted in a positive test finding, meaning that the MRI showed a finding related to the indication of the test, and only 3% of MRIs were inconclusive. The most common indication for an MRI was a stroke or transient ischemic attack. The majority of inpatient MRIs were ordered as urgent priority status, and 94% of the total orders were assigned an appropriate priority status as per the radiologist review. This study is important as it demonstrated that TBR-HSC physicians use MRI resources wisely according to evidence-based guidelines. On review of the MRI orders deemed inappropriate, about half of these orders did not follow guidelines, and the remaining had reports from specialists to not order an MRI for the specific indication. One limitation of this study was that it only included data from a 1-month time period. Overall, from this data, our impression is that the Choosing Wisely Canada strategy is being used at TBR-HSC, and physicians should strive to maintain this standard.